Hi dear friends, I am Dr. Omkar prasad Baidya, MD PhD from King George Medical University, Lucknow, and working in a medical institute as assistant professor. Today, I'll be discussing a very important topic: how to control blood pressure by natural means without any medication. So we can say, how to control blood pressure at home. Now, high blood pressure is one of the important medical problem throughout the world, especially in this COVID season, COVID-19. We know that there is COVID-19 is a health emergency that is passing its pandemicity throughout the world. It has taken so many lives throughout the world, and because the virus infects both respiratory system and cardiovascular system. That's why it is very much important for those subjects who are hypertensive or who has high blood pressure to normalize their blood pressure or keep their blood pressure normal so as to keep their cardiovascular system fit. High blood pressure may be a life-threatening condition because it increases the chance of stroke, coronary artery disease, heart failure. Also, it increases the chance of chronic kidney disease, kidney failure, even cerebrovascular accidents. Besides that, it has so many other complications also throughout the body. Billions of people are suffering from hypertension, and majority of them really don't know that they are suffering from hypertension at all. And even they know, they are not under proper medication. And many of them has inertia for taking allopathic medicine, thinking for every aspects. This video has been considered so as to show many subjects or patients who wants to control their blood pressure normally, naturally at home without any medication. So what are the various methods? We'll discuss one by one, but before that we should know that blood pressure can be defined as a lateral pressure exerted by blood while flowing through a blood vessel. It is two components, systolic component and diastolic component. Systolic component is called systolic blood pressure, and diastolic component is called diastolic blood pressure. Systolic blood pressure can be defined as the highest blood pressure that can be recorded during the cardiac cycle, and that is during the systole, and it depends on cardiac output. And diastolic blood pressure is the lowest blood pressure that can be recorded during the cardiac cycle, and that is during diastole. And systolic blood pressure depends on cardiac output, and diastolic blood pressure depends on peripheral resistance. And physiologically, to understand in a very detailed way, we must know that blood pressure can be given as cardiac output into peripheral resistance, where cardiac output is the amount of blood pumped by each ventricle per minute, and peripheral resistance is the resistance offered by the vessel while when the blood is passing through it. So again, I am telling blood pressure or BP can be expressed as a product of cardiac output and peripheral resistance. Cardiac output is nothing but the amount of blood pumped by each ventricle per minute, and peripheral resistance is nothing but the resistance offered by the vessel when the blood is flowing through it. So this product is this concept is very much important as it can explain many phenomena and how to show some methods how to reduce the blood pressure. Now, there are a number of ways to control the blood pressure or to lower the blood pressure or to normalize the blood pressure by natural means without any medication. So first one we can start with, that is very much important, is walking or taking exercise regularly. So regular exercise is very much important for every subjects. Regular exercise temporarily may increase the systolic blood pressure, but regular exercise overall, after effect, it has a soothing effect on the heart. It lowers down the blood pressure, both systolic and diastolic. And it has been seen that after exercise, there is a regular exercise can lead to the fall in diastolic blood pressure, or even up to 4 to 5 millimeter of mercury. Now, how the exercise regular exercise and regular what's the blood pressure? Actually, regular exercise increase the vagal tone, and because of vagal tone, the vagus nerve parasympathetic stimulation occurs, and it inhibits the heart. So there is a fall in heart rate, resting heart rate, and ultimately it lowers the blood pressure. Now, what type of exercise can be done for regular? We can do walking, which is the most common. Those subjects who are hypertensive already or already having some cardiovascular manifestation, for them walking is the best. Others can do aerobics like cycling, running, jogging. So these are the best exercise because they are also called cardiopulmonary exercise that makes the cardiovascular system fit and respiratory system fit. At the same time, they also increase the athletic endurance, and for heart, it decreases the risk of coronary artery disease, and at the same time open up new vessels in the or causes angiogenesis in heart, or can open up new capillaries in the heart and reduce the chance of myocardial infarction or coronary artery disease in the future. So it is always advisable to do regular exercise, at least 30 to 45 minutes regular exercise per day, and that may decrease the chance of coronary heart disease. At the same time, it may lower the blood pressure, both systolic and diastolic. So regular exercise is very much important, and it is the first important natural method that can lower the blood pressure or keep our pressure under control. Next important point we should follow is to reduce our sodium intake. Sodium is present mostly in the salt, even it is present in the canned foods or processed foods like pickles, then chips, potato chips, or it can be added extra in your diets. So we have to cut down extra sodium from our diets. Don't take raw sodium chloride or salts along with our diets, and to cut down the sodium we should avoid taking extra salt in our diet, and by doing this it may cause reduction in blood pressure and helps in lowering the blood pressure. And especially for those hypertensive subjects who are salt sensitive, lowering the sodium intake or cut down the sodium intake through our diets has a good sensitive effect on lowering the blood pressure. So you must try to take lower amount of sodium in our diet so as to decrease the or normalize the blood pressure. Next important point is we have to cut down the alcohol intake or alcoholism, or better to say drink less alcoholism. Now alcoholism in very moderate or mild amount may be beneficial for heart. In some text or literature they said it may be good for keeping the cholesterol level normal also if it taken in moderate or lower amount. But if it's taken in higher amount, it is very much cardiotoxic. It increases the blood pressure and ultimately affects the chance of or risk of coronary artery disease as well as stroke, because it increases the chance of getting hypertension for the subjects who are taking their alcohols in regular basis in severe amount. So we have to cut down or better not to take alcohol at all. Next important point is we have to take more amount of potassium rich diet. So potassium is important ion which lowers the BP. So it is advisable for all the patients who are suffering from hypertension or to take potassium rich diet like banana or green leafy vegetables, some fish like tuna, mackerel, dairy products, some beans. These are rich in fruits and vegetables, especially banana. It is rich in potassium. So potassium rich diet is advisable for those patients who are hypertensive. Potassium causes vasodilation, and it also decreases the chance of sodium reabsorption through kidneys and sodium retention. Ultimately, it also decreases the chance of water reabsorption by the kidneys, and that's why it lowers down the blood pressure. Thus, potassium rich diet is very much important, as it is a methodical way of lowering the blood pressure. So it is always advisable to take potassium rich diet. But those patients who are suffering from kidney disease or having chronic kidney disease, they cannot tolerate potassium for longer time as their kidney is not excreting potassium. So for them, they cannot take potassium rich diet. So for them, they have to moderate their potassium intake, and they can consult doctor for that. Otherwise, healthy subjects who are taking, whose kidney is working normally, they can take potassium rich diet, as it can moderate or normalize the blood pressure or keep the blood pressure in lower level. Next important thing is factor that can be, or means or method by which we can lower down the blood pressure is to cut down the caffeine in our regular day-to-day life. So caffeine is nothing but present in coffee. So in some studies have shown that coffee has a incremental effect of blood pressure. That is, momentarily when a person or individual take coffee, it causes increase in blood pressure, but after some time it decreases. So there, those persons who are very sensitive to caffeine, they may show rise of blood pressure with caffeine intake or caffeine intake. So for them, it is always advisable to take less amount of coffee, or better to restrict coffee intake or caffeine through in our day-to-day life practice. So restricting caffeine also in our diet is also one of the important factors by which we can lower down our blood pressure. Next important factor is stress management. Now stress is such a biological phenomena which has to be, everyone has to be faced in our day-to-day activity, and depending on the situation, somehow chronic stress especially, it releases a hormone like cortisol, glucocorticoids, and even adrenaline, noradrenaline, and keeps the body in a fight and flight mode or excitation mode. And because of that, the BP will be in higher level, and constant or chronic stress may lead the person to hypertension, and they prone for stroke, coronary artery disease, and many other cardiovascular as well as coronary and hypertensive situations. So how we have to manage stress? We can avoid stress by avoiding excessive work, or listening music, or doing yoga and meditation. Yoga meditation is very much good for our body. It de-stress ourselves, and at the same time, listening to movie can also relieve ourselves from stress. So stress management is very much important. You can talk to your physician in case you cannot manage your stress at home. But one thing is advisable, that always do yoga and meditation, or avoid excessive work which can lead to stress. Or at the end of work, listen to some music which can calms or has a soothing effect on our mind, and equilibrates our body-mind interaction. So we have to somehow distress ourselves by doing yoga and meditation, because chronic stress is not good for our heart, and it is not good for hypertensive subject, because chronic stress can lead to hypertension in the future. At the same time, those subjects who are facing chronic stress in regular day-to-day life, they have a high prone to resort to alcoholism, smoking, and many other drug abuse, and which also increase the chance of hypertension in future. Next point is very interesting point. Those chocolate lovers, it is very good news that, or for those subjects or those persons who loves chocolate, for them there is a good news that taking dark chocolates or cocoa, or chocolates having cocoa, can lower down the blood pressure. So sometimes you can take dark chocolate with less sugar, low sugar dark chocolate in day-to-day life, or occasionally, which can say lowering effect on the blood pressure. So take dark chocolate which can lower down the blood pressure. Next important method by which you can lower down your blood pressure without any medication is losing the weight, or decreasing our weight. So weight is very much important actually. The person who has a higher BMI or overweight, or a person who are suffering from obesity, they have high chance of prone to cardiovascular risk. At the same time, they have a high chance of suffering from hypertension in the long run. That's why weight reduction is one of the important means by which blood pressure can be lowered, or we can normalize our blood pressure. So at least it has been found that in some studies that at least 4 to 5 kgs of weight loss can also lead to lower down the blood pressure. So at the same time, lowering our weight also decreases our chance of getting coronary heart disease and stroke and various other cardiovascular problems. At the same time, it also lowers the blood pressure, which is very much important for keeping our cardiovascular status fit or hemodynamically fit. So that's why most important thing is that we can lower our weight. How to lose weight? That is the most important thing. It needs a perfect lifestyle modification or lifestyle changes. How will do it? You can do exercise, regular exercise that I've already explained. Regular exercise also cause breaking our fat or removal of fat, so it prevents weight gain. At the same time, take low fat diet. That is another important advice for losing weight. Take low fat diet and low carb diet, or avoid refined carbohydrate diet, because refined carbohydrate diet leads to hypercholesterolemia and increase the cholesterol level in the blood, which may lead to atherosclerosis and future coronary artery disease or vascular disease. So do regular exercise, do dietary changes, take fruits and vegetables, avoid fatty diet, avoid high fat rich diet, and take low carb diet, and you can take protein diet also. So dietary changes as well as exercise is very much important, which can play an important role in weight reduction or weight management, or help in losing weight. And losing reduction of weight is very much important, and it can normalize the blood pressure, and at the same time it decreases our chance of having future coronary artery disease and stroke, and also free a person from obesity. Next important point which can help you in reduction of blood pressure or normalize our blood pressure is to quit smoking or cut down your cigarettes. So smoking is very injurious to health, all of you know. So immediately, as soon as a person smokes, within few minutes there is an immediate rise of blood pressure, and gradually with time it will comes down. But those subjects who are taking regular smoking or chronic smoker, they have a higher risk of hypertensive effect of nicotine. Nicotine is a vasoconstrictive substance which is present in the cigarette and smokes, and this nicotine is a hypertension and responsible for hypertension. It also increases the chance of future coronary heart disease or myocardial infarction or heart attacks, or even leads to chance of stroke also. That's why better to avoid smoking or quit smoking, or those who are smokers try to go some rehabilitation center and try to take some measures to stop smoking, and you can talk to physician to avoid smoking. So tobacco actually increase the blood pressure. So tobacco, which also contain nicotine, and nicotine is a vasoconstrictive substance which is the highly addictive. At the same time, it is increase the chance of cardiovascular risk, makes the heart prone to myocardial infarction, coronary heart disease, and it increases the blood pressure in the long run. So one of the important point by which we can normalize our blood pressure is to cut down our smoking or quit smoking. Next important point or measure we can take is lower down the sugar and refined carbohydrate. It has been studied, many studies shows that refined carbohydrate like maida, flour, they have a effect on the blood pressure by increasing it. Means high carb diet or high sugary diet or high diet containing refined carbohydrate increase the chance of hypertension, because it increases the blood pressure. And another important effect is that those person taking higher sugary diet or higher carbohydrate diet, they will gain their weight and they become obese, and because of obesity they have a high chance of gaining their blood pressure with time. So they are more prone to coronary heart disease, cardiovascular disease, stroke, and hypertensive crisis, and these situations in the future. That's why it is always advisable to avoid refined carbohydrate and to avoid sugary diet, because they have increased chance of increase a person chance or risk of hypertension in future. At the same time, they also increase the refined carbohydrate increase the chance of cholesterol level in the blood. So increased amount of cholesterol in the blood is very much responsible for atherosclerosis and future peripheral vascular disease and heart attacks and hypertension. So it is advisable to avoid refined carbohydrate and take low sugar diet. Eat blueberries. By eating berries, we can cut down our hypertension or lower the blood pressure. Berries contain polyphenols which lowers the blood pressure and decrease the chance of coronary artery disease and cardiovascular disease. Next important point is doing regular meditation and deep breathing. Meditation, yoga and deep breathing is very much important, which is also a respiratory part of respiratory exercise, and at the same time it soothes our mind, calms down our mind, and it is responsible for distressing ourselves. Meditation and regular meditation, yoga and deep breathing increase our parasympathetic stimulation or increase our vagal tone, and because of increasing our vagal tone, it decreases our heart rate and ultimately decreases our blood pressure. At the same time, regular yoga, meditation, deep breathing also has a distressing effect on our body and mind. It decreases our level of stress and ultimately decrease the chance of future coronary heart disease or cardiovascular disease and hypertension. Besides, yoga and meditation causes sympathovagal equilibrium, which is a very much important effect on normalizing our blood pressure or keeping our blood pressure normal. So that is the importance of doing meditation, deep breathing and regular yoga. At the same time, yoga also causes, as it is a regular exercise on affect the respiratory system, it can improve our lung compliance and ultimately keeps our respiratory system fit. Next important point or measure you can take is you can add calcium on your diet or eat calcium rich diet. So eating calcium rich diet, it has been found that it has a normalizing effect on the blood pressure. It lowers down the blood pressure. So we can take tofu, green leafy vegetables which may contain calcium, but especially and dairy products also. But too much dairy products may lead to hypercholesterolemia or increased chance of cholesterol level in the blood, which may increase the chance of atherosclerosis in the future. So to avoid that, you may take skim milk or low fat milk which also contain calcium, or tofu and dark leafy vegetables or green leafy vegetables which contain or which is rich in calcium diet. Okay, so calcium rich diet also helps in lowering the blood pressure. Next important point that you should not forget or measure that we should take in lowering the blood pressure is to add some natural supplements. Now it is found that various natural supplements or nutrition also plays important role in lowering our blood pressure. So most important natural supplement we can take is garlic, or also known as rasul. So garlic extract is one of the important natural nutritional supplement that can lower down the blood pressure. Besides, it has anti-septic effect, it is anti-inflammatory effect, it is good for kidney, it lowers down the blood pressure, it also prevents future risk of heart disease, and it is anti-cancer also. So it is main multi-purpose effect. So take rasun or garlic extract every day, and it can lower down your blood pressure. Next is berberine. Berberine is a type of nutritional supplement which is rich of nitric oxide. Nitric oxide is an important vasodilator, and it can lower down the blood pressure. Whey protein. Whey protein, those individuals who are doing regular exercise or doing muscular exercise, they are taking whey protein. So whey protein is a protein rich diet. This protein rich diet has a normalizing effect on the blood pressure. So you can add whey protein in your diet, which can lower your blood pressure or keep the blood pressure normal. Fish oil. Fish oil contains omega-3 fatty acid. All of you know, or if you don't know also, you must know that fish oil is very much good for heart. It contains omega-3 fatty acid, which is a cardioprotective fatty acid. At the same time, it can lower down the blood pressure. So you can take diet oil or fishes which are rich in oil or fish oils, mostly present in sea fishes, So this may be good for your heart as well as lower down the blood pressure. And you can add some special type of nutrition like coenzyme Q10. It's a nutrition or supplements which it also lower down the blood pressure. So it is normalizing effect on the blood pressure. Next important point which can lower down the blood pressure naturally is add food rich in magnesium. So adding magnesium in your diet, there is a chance that blood pressure may come down because magnesium has a vasodilative effect. It dilates the blood vessels. Now as soon as the blood vessels are dilated, the peripheral resistance will fall, and because of fall in peripheral resistance, blood pressure will fall. So magnesium has a vasodilatory effect, and because of that it can lower down the blood pressure. So it is always advisable to take magnesium rich diet. Now where you will find magnesium? You can find magnesium in legumes, you can find magnesium in whole grains. Okay, you can find magnesium even in green leafy vegetables also. So try to add magnesium in your diet. It can lower down your blood pressure gradually. And another important measure, or those patients who are suffering from hypertension, they must follow DASH diet. What are DASH diet? DASH diet means dietary approaches to stop hypertension. So that is, in short, we are known as DASH diet. So what is DASH diet? DASH diet can decrease our blood pressure by 11 millimeter of mercury column. So it is a good effect on our blood pressure. It can normalize our blood pressure. It can lower down the blood pressure even up to 11 millimeter of mercury column. So what we have to include in it to follow a DASH diet? We have to eat food containing fruits and vegetables. So fresh fruits and vegetables we have to add very much in our diet. It is a lowering effect on our blood pressure. We have to avoid low fat diet and dairy products, because dairy products mostly it contain high amount of cholesterol and fats. So we have to add low fat diet and avoid dairy products, and we have to avoid foods containing high sodium, or we have to take low sodium foods. And at the same time we can take whole grains. We can take fish, poultry, beans, and better to avoid animal meats or red meats, which are very fatty meats and contain high level of cholesterol and may increase the chance of hypercholesterolemia and coronary heart disease or myocardial infarction in the future. That's why to keep our cholesterol level normal and keeping our pressure normal, it is always advisable to follow DASH diet or dietary approaches to stop hypertension. And what is that? We have to include fresh fruits and vegetables in our diet, avoid high sodium content in your diet, or take low sodium diet, low fat diet, avoid dairy products, take more green leafy vegetables, whole grains, fish, avoid meat rich in fats and cholesterol. So these are DASH diet. DASH diet is very much effective, and it is been seen that, and it is found that even it can decrease our blood pressure up to 11 millimeter of mercury column. So DASH diet is very much important. Those hypertensive subjects are always advised to take DASH diet. Now another important point, that these days with the advent of junk foods, people like processed food like pizza, or they like pickles, they like chips or burgers. They contain many added salts. So they are canned foods. Canned foods, processed foods contain high amount of sodium in its as a diet, and this high amount of sodium is responsible for hypertension in subjects. That's why avoid processed foods, pickles or canned foods, and this may cut down your sodium entry in your diet, or causes sodium restriction and lower your sodium level in the blood, and ultimately leads to lower your blood pressure. Then sound sleep. Another important factor we should not forget is sound sleep is very much important in normalizing our blood pressure, because when a person sleeps, it decreases our blood pressure or normalizes our blood pressure. So those persons who are suffering from insomnia or deprivation of sleep, they have high risk of having future hypertension, and even they are prone to stroke and diabetes and even coronary heart disease. That's why we should have proper at least 6 to 8 hours of sleep normally in every day-to-day life. Next one important factor we should follow is you should add high protein diet and high fiber diet. So high fiber diet is very much important because it can lower down the blood pressure. At the same time, high fiber diet decreases the absorption of cholesterol in our diet. Now, decreased amount of cholesterol in our diet is responsible for keeping our cholesterol level normal, and ultimately it prevents our from hypercholesterolemia and coronary vascular disease and normalize our blood pressure. At the same time, high protein food also responsible for normalizing of blood pressure, but those subjects who are suffering from any kidney disease or chronic kidney disease, for them high protein diet cannot be followed because high protein diet may cause or aggravate the kidney problems. So that's why those subjects having kidney problems, they should take moderate amount of proteins, or according to the nephrologist as advisable. So for them they should take low protein diet, but they can take high fiber diet. So high fiber diet means increasing green leafy vegetables in your diet. So I can name some important vegetables, fruits and vegetables that can be added in your diet, which can lower your blood pressure if you take it in a long run manner. So number one is green leafy vegetables. Green leafy vegetables like spinach you can add, or turnip also you can add. They have a so good effect on the lowering the blood pressure. Then berries, I told you it contains polyphenols, so berries are important. It can decrease lower your blood pressure. Red beets, red beets contain nitric oxide, which has important vasodilator and can lower the blood pressure. You can take skim milk. Skim milk contains calcium. We know calcium-rich food is very much important, but you have to avoid the cholesterol of the milk. That's why milk after toning, double toning or single toning milk or skim milk is better because it contains calcium and it also contains potassium also. So milk contains potassium, which can lower our blood pressure. You can add oatmeal. Oat contains high fiber diet and low fat diet and cholesterol free diet. At the same time, it also contains low amount of sodium. So oatmeal is very much important for those persons suffering from hypertension. It also normalizes our cholesterol level in the blood cholesterol level and also normalize our blood pressure. So you can take oatmeal as your breakfast. Bananas are actually, everyone likes bananas. It's a very tasty fruit. It contains lots of potassium, and potassium rich diet is very much important as it lowers the blood pressure. Some fishes like salmon, tuna, mackerel you can add. They contain good fish oil like omega-3 fatty acid, which is an effect on cardioprotective effect as well lower down the blood pressure. You can take some sunflower seeds or some seeds, nuts also, which has a good cholesterol in it, and they have an effect on lowering the blood pressure. We can take garlic also, or rasun. Rasun has a lowering effect and cardioprotective effect. It is good for kidney also. It has so many protective functions. So almost everyone try to have a garlic or rasun in your early morning in your diet. You can add rasun in your diet. And you should, for those who are chocolate lovers, for there is a good news that dark chocolate is good. I already told. So you can add dark chocolate or chocolate with cocoa powder